Welcome everyone. Today we are presenting on Bowen Family Systems Theory, a major family therapy model that views the family as an emotional system rather than as a group of isolated individuals. Our goal is to explain the theory clearly, connect it to family therapy practice, and show how it can be applied clinically. As a team, Angel Ward and I, Wilbert Francis, will move from theory to application. We will introduce the major theorists and assumptions, explain the main concepts, and then use the fictional Echevarria family to demonstrate how a Bowen-informed counselor might understand and intervene with family anxiety, triangles, and multi-generational patterns. This agenda follows the assignment requirements. We begin with the introduction to the theory, including the theory name, major theorists, historical background, and primary assumptions. We then move into major concepts, Bowen's view of family problems, goals of therapy, the role of the therapist, interventions, strengths and limitations, multicultural considerations, reflection, discussion, and references. The Echevarria family will serve as a case thread throughout this presentation. That case helps us keep the focus on family therapy practice rather than discussing Bowen theory only as an individual counseling approach. Bowen Family Systems Theory is grounded in the idea that the family functions as an emotional unit. Even when the family members feel distant or disconnected, their behavior, anxiety, and decision-making may still be shaped by the larger family system. A Bowenian counselor does not deny that Sophia's anxiety is real. Sophia, by the way, is the daughter of the Echevarria family. Instead, the counselor asks how the symptom is connected to family patterns, anxiety, closeness, conflict, and distance. The clinical question shifts from what is wrong with Sophia to how is Sophia functioning within the family emotional system. This shift reduces blame and helps the counselor observe process. Murray Bowen is the central theorist. He developed Bowen Family Systems theory and introduced major ideas such as the family as an emotional unit, differentiation of self, triangles, and multi-generational transmission. Michael Kerr helped organize and extend Bowen's theory, especially around family evaluation, chronic anxiety, and emotional process. Monica McGoldrick, Randy Gerson, and Sweli Petri are important because of their work on genograms, which allow counselors to map family patterns across generations. Daniel Papero and Peter Titelman also contributed to clinical Bowenian practice and the continuing development of differentiation of self theory. Bowen developed his theory through psychiatric training and clinical research, including work with families affected by schizophrenia. His observations led him to question purely individual explanations of emotional distress. He increasingly saw symptoms as connected to the relationship system surrounding the identified patient. This historical shift matters because Bowen helped move family therapy toward a systems perspective. The focus became not only the person with symptoms, but also how anxiety, fusion, distance, and patterns of functioning are organized within the family over time. Bowen theory assumes that families are emotional systems. Members influence one another, and anxiety can move through the system in predictable ways. When anxiety rises, one person may overfunction, another may withdraw, another may blame, and another may become the focus of concern. The theory also assumes that patterns are often multi-generational. Families pass down ways of handling closeness, conflict, responsibility, achievement, distress, and emotional distance. The goal is not to separate people from family, but to help them remain connected while functioning with more clarity and less automatic reactivity. The Echevarria family gives us a clinical case for applying the theory. Miguel is a father who works long hours and tends to become quiet or unavailable when family conflict arises. Isabel is a loving and protective mother whose concern can become anxious involvement with Sophia's life. Sophia is the identified client. She presents with anxiety, perfectionism, sleep difficulty, and college stress. Lucas, her younger brother, may become less visible because so much family attention is organized around Sophia. From a Bowenian lens, the question is how Sophia's anxiety became connected to the family's way of managing worry, closeness, distance, grief, and responsibility. This genogram is one of the most powerful Bowen-informed assessment tools. It allows the counselor to look beyond the presenting symptom and map family structure, relationship patterns, losses, illness, substance use, cutoff, and roles across generations. In the Echevarria genogram, Sophia's anxiety can be considered in relation to maternal anxious closeness, paternal emotional distance, Raphael's alcohol abuse. Raphael's her grandfather, by the way. So Raphael's alcohol abuse and death, family illness, and Luca's peripheral position. The purpose is not to blame the family, but to make patterns visible so the family can think about them more clearly. Major concepts. There are 8 interlocking concepts. Bowen identified 8 interlocking concepts. They are not separate techniques. They work together as a clinical lens for observing family functioning. Differentiation and triangles are often foundational because they help us understand how people respond when anxiety rises. The other concepts, nuclear family emotional process, family projection, multi-generational transmission, sibling position, emotional cutoff, and societal emotional process, help counselors understand where symptoms emerge, how family patterns repeat, and how larger social forces may affect the family. Differentiation of self is the cornerstone of Bowen theory. It means being able to stay emotionally connected to others while maintaining a clear sense of self. A person with lower differentiation may fuse, blame, cave in, emotionally flood, or cut off when relationships become stressful. Higher differentiation does not mean cold independence. It means the person can remain connected and emotionally present while also thinking clearly and acting according to values. This concept must be used with cultural humility because family loyalty and interdependence should not automatically be labeled as poor differentiation. Major concepts. Triangles. A triangle forms when anxiety between two people is managed by involving a third person, topic, or issue. Triangles can reduce anxiety temporarily, but they may also place pressure on the person who becomes the focus. In the Echevarria family, Miguel and Isabel experienced tension about parenting and Sophia's future. Rather than addressing the parent-to-parent anxiety directly, the family focus shifts towards Sophia. Isabel monitors more closely Miguel's distance, and Sofia experiences increased pressure. The counselor's task is to stay detangled and help the family observe the process without taking sides. Other key concepts. This slide summarizes several additional concepts. Emotional cutoff refers to managing unresolved anxiety through distance. Family projection describes how parental anxiety may become focused on one child. Multi-generational transmission explains how emotional patterns pass across generations. Nuclear family emotional process describes how anxiety appears in the immediate family through conflict, symptoms, dysfunction, or distance. Sibling position helps us ask what role each child occupies in the family emotional system, while societal emotional process reminds us that families do not function in isolation. Cultural context, economic stress, discrimination, and institutional pressures can intensify family anxiety and shape the available coping options. Bowen theory understands family problems as patterns of emotional process rather than simply as individual pathology. Symptoms are real, but they are also embedded in a relational system. The counselor asks how anxiety moves, who reacts, who distances, who becomes responsible, and how the pattern repeats. In the Echevarria case, Sofia's anxiety may reflect more than individual stress about college. It may also reflect parental worry. Miguel's emotional distance, Isabel's anxious over-involvement, grief and loss in the family history, achievement pressure, and Lucas becoming less visible in the system. A Bowenian case formulation validates Sofia's anxiety while refusing to make her the family problem. On Miguel's side, Rafael's emotional restraint, alcohol abuse, diabetes, and death may shape Miguel's tendency to work hard and distance under stress. On Isabel's side, closeness may be expressed through monitoring, advice, protection, and worry. The clinical hypothesis is that Sofia is positioned at the intersection of maternal anxious closeness and paternal emotional distance. Her symptoms may function as the place where family anxiety becomes most visible. Lucas's experience also matters because he may cope by becoming humorous, quiet, or peripheral. The primary goal in Bowen therapy is increased differentiation. The counselor helps family members stay emotionally connected while functioning with more clarity, self-responsibility, and less automatic reactivity. Progress is not measured only by symptom reduction. In the Echevarria family, progress might look like Isabel worrying less intensely, Miguel staying emotionally present instead of distancing, Sofia speaking more clearly about pressure and college expectations, and Lucas being included as a meaningful member of the family system. Small shifts in functioning can matter. The Bowenian therapist functions as a coach, not as the expert who rescues the family or decides who is right. The therapist helps family members understand process, slow down reactivity, and make more thoughtful choices. This requires the counselor to remain connected without becoming emotionally pulled into any one person's side. The therapist's own differentiation matters. Bowenian work asks counselors to understand their own family patterns so that they do not react automatically to clients' anxiety, conflict, or requests for alliance. At the same time, neutrality must not mean silence about safety, abuse, coercion, or ethical responsibilities. Bowen therapy is less about giving quick advice and more about helping clients observe and change their part in the emotional process. Key tools include genogram work, process questions, I position statements, coaching, detriangulation, relationship experiments, and family of origin work. Process questions are especially important because they slow the conversation down. Instead of asking who is to blame, the counselor asks, what happened first? Who noticed? Who responded? What changed next? This helps the family see the sequence and identify a place where one person can respond differently. The therapeutic process often begins with assessment and genogram development. The counselor maps family structure, cutoffs, triangles, anxiety, losses, culture, and patterns of differentiation. Psychoeducation then helps clients become observers of their own family system. As therapy continues, coaching helps clients practice new responses outside the session. Detriangling means stepping out of the middle position without blaming, cutting off, or becoming emotionally distant. The expected outcomes are reduced reactivity, clearer sense of self, improved relationships, and less repetition of intergenerational patterns. With the Echevarria family, the genogram would be used therapeutically rather than simply as an intake tool. The counselor would help the family connect Sophia's anxiety to grief, chronic illness, alcohol abuse, closeness, distance, and family role expectations without blaming any one person. The counselor would coach Miguel to notice his distancing and coach Isabel to remain connected while reducing anxious monitoring. Sophia could practice I position statements about college and pressure. Lucas's experience should be invited so he does not become emotionally invisible. Small relationship tasks outside the session help the family practice calmer contact and clearer responsibility. Bowen theory must be applied with cultured humility. In many collectivist immigrant extended family or religious communities, closeness and interdependence may be valued and healthy. A counselor should not automatically interpret family loyalty as fusion or distance as pathology. Culture shapes the meaning of authority, gender roles, respect, spirituality, emotional expression, and help seeking. For Latino families, for example, values such as falismo, respeto, personalismo, faith, and extended family connection may be sources of resilience. Bowen concepts are useful only when interpreted within the family's cultural context. Socioeconomic stress can intensify family anxiety. Families may be dealing with housing insecurity, food insecurity, transportation barriers, unsafe neighborhoods, unfounded schools, employment instability, and limited access to health and mental health care. A culturally responsive Bowenian counselor should not label survival-based responses as dysfunction without understanding the family's material conditions. In the Echevarria family, work demands, academic pressure, and limited resources could shape how parents respond to Sophia and how Lucas learns not to ask for help. Systems thinking should be paired with social awareness, advocacy, and humility. A major strength of Bowen theory is that it prevents the counselor from reducing a person to a symptom or diagnosis. It places the presenting concern within a broader family emotional context. This can reduce blame and help families think more calmly about repeated patterns. The genogram is also a practical strength because it gives the counselor and family a visual tool for understanding relationship patterns, losses, roles, illness, cutoffs, and intergenerational patterns. Bowen theory can also be used systematically even when only one individual, rather than the whole family, attends therapy. Bowen theory also has limitations. The concept of differentiation can reflect Western individualistic assumptions if it is applied without cultural humility. The approach can also be abstract, slow-moving, and less appropriate as the only intervention during crisis situations. Another concern is that Bowen theory may under-de-emphasize power, oppression, racism, poverty, disability, gender inequality, trauma, or safety concerns if the counselor focuses only on family process. Therapeutic neutrality must never become silent about abuse, coercive control, mandated reporting, or immediate risk. Bowen therapy may fit best when the presenting concern is connected to chronic family anxiety, repeated relationship patterns, emotional cutoff, parent-child tension, couple conflict tied to family of origin issues, or major transitions such as launching, illness, grief, and college stress. Bowen therapy may fit least as a standalone treatment when the client or family is dealing with active abuse, coercive control, immediate safety risk, acute suicidality, untreated psychosis, severe untreated substance use, or crisis stabilization needs. The theory can be helpful later, but safety, stabilization, and ethical responsibilities come first. This slide highlights resources that support Bowen-informed practice. Gladding provides a course-friendly overview of family therapy models. Bowen, Kerr, and Bowen and Pompero provide core theory and clinical reasoning. McGoldrick, Gerson, and Petrie provide practical genogram guidance. The multicultural and assessment resources are also important. APA's multicultural guidelines, Falikov, McGoldrick, and Hardy, and Su and colleagues help counselors avoid applying Bowen's concept in culturally narrow ways. Differentiation of self-measures may support research and conceptual assessment, but they do not replace clinical judgment, supervision, or culturally responsive formulation. Reflection, future counselor use and cautions. As future counselors, we could use Bowen's theory when a client's concern appears connected to family anxiety, repeated relational patterns, emotional cutoff, or intergenerational stress. In the Echevarria case, the model helps us avoid blaming Sophia and instead examine how worry, grief, illness, alcohol abuse, achievement pressure, and emotional distance move through the family system. We would use Bowen theory cautiously when immediate safety, abuse, coercive control, acute trauma, or severe social stress requires more direct intervention. We would also seek supervision and use cultural humility so that family closeness, spirituality, interdependence, and respect for elders are not mislabeled as pathology. Discussion questions. These questions are designed to move the class from theory into clinical reasoning. The first question asks, how we validate Sophia's anxiety without turning her into the family problem. That is the central Bowenian stance because symptoms are real, but they are also connected to family process. The remaining questions ask classmates to identify triangles, adapt differentiation for collectivist or extended family systems, and consider how genogram work can be trauma-informed and culturally responsive. These questions should help the class apply Bowen theory rather than simply recall definitions. Key takeaways. The main takeaway is that Bowen theory views the family as an emotional system. Symptoms are not ignored, but they are understood in relational and multi-generational context. Differentiation of self is the central goal, and the triangles are one of the primary ways families manage anxiety. The genogram makes patterns visible, but the counselor must use the model with cultural humility and attention to safety, power, trauma, and social context. The Echevarria case shows how one person's symptom may reflect a larger family emotional process rather than an isolated individual problem. Here are references. Here are additional references. And here is our last slide of references. I'd like to thank the class for paying keen attention to this presentation.